South East Radio's Business Matters with Carl Fitzpatrick.
South East Radio.
While almost half of the Irish adult population have private health cover, this percentage is significantly lower for younger adults. A new startup, VIGO Health, is hoping to address this imbalance with a tailored day-to-day expenses offering. The CEO of VIGO Health, Ruth Bailey, joins us now to tell us more. Ruth, we'll be discussing the business which you have co-founded, VIGO Health. But first, I'd like to get an insight into your own background.
Sure. So I guess I've always been entrepreneurial in nature. VIGO Health is my fourth startup. So a bit of a glutton for punishment when it comes to that. I started off, I suppose, in college. I studied marketing. My undergrad was in marketing, and I did my master's in strategic management. And then I started working in what was Viva Health. And Viva Health was then acquired by what was then called Hibernian Insurance, now would be known as Aviva. And we were rebranded as Aviva Health, and I became the head of marketing there. So stayed there for a few years, and then I left Aviva Health in 2011, and I joined a group of people to set up Glow Health. Stayed in Glow Health for a few years, and then Glow Health was acquired by Irish Life in 2016. At the time, Irish Life also bought Aviva Health, so it would have been my previous employer as well, and integrated both Glow Health and Aviva Health together and made what is today Irish Life Health. So I was in Irish Life Health for a few years and then decided to leave along with my co-founder Stephen Lockman, who was also the CFO in Irish Life Health and also the CFO in Glow Health. And both Stephen and I left to work on and set up VIGO Health.
So there's no doubting your credentials in the health insurance space, but what prompted you to establish VIGO Health?
Both Stephen and I had been observing over the years the decline of the penetration of health insurance among younger adults. So just to kind of, give you a few statistics, these are Health Insurance Authority, HIA, publicly quoted stats. Typically, the average holding of health insurance in Ireland is 47%. So just a little less than the Irish population choose to have health insurance. But when you look to the under 35, so the younger adult segment, that penetration falls to less than 25%. So the younger adult age group, that segment are, under-indexing quite significantly in terms of holding health insurance. And, that's a trend that has been, increasing every year over the last couple of years. So Stephen and I came together and we had a chat, and we both firmly believed that this group, this segment they are interested in their health and they are interested in their health and well-being, but just that health insurance in its current format is not relevant for them and wasn't relevant to them. So they were choosing not to have health insurance, but that doesn't mean that there wasn't a need. So I suppose that's how we started off the hypothesis, if you like, that there was a gap in the market for this segment where their needs weren't being met, and we set about researching their needs, and that's how we came about and came up with the idea around what we offer in VIGO Health.
OK, and before we discuss what you offer now today through VIGO Health, as part of that research, did you find at all that cost was one of the main prohibiting factors in their decision?
Yeah, look, it's a good question, and it's one that people would say, well, of course I don't buy health insurance because it feels too expensive. But I think what we actually learned was that it's more about value, right? And what I mean by value is, the average health insurance premium is around about €1,500 at the moment. Obviously, there's plans that are more expensive and there's plans that are cheaper, but that's the average premium according to the HIA. So our target segment, it's not that some of them couldn't afford the monthly premium or they couldn't find a way of paying for it. They just felt that it didn't represent good value to them. And, certainly the research told us that, this group felt that the product, it wasn't relevant to them. And, when I talk about relevance and value, what I mean is here's a group of people who, think that, sure, I'm not going to need to go into hospital. I'm going to live forever. It's just not something that I need to spend money on right now.
So what did you need to do to build out a product that was going to be relevant?
We developed a proposition around that's kind of centred or led by digital health services. So you can send a WhatsApp to one of our nurses with a clinical question. So, I've got a migraine, I've burnt my hand, anything like that. But you can also ask things like navigational questions. How do I find a particular health practitioner in my area? How do I access care? Because that came out of our research as being really important. So we've got WhatsApp a Nurse, which is instant. You don't need an appointment. We've got a 24/7 message a doctor service where you can send a WhatsApp to an Irish-based GP 24 hours a day and get a response back within a couple of minutes. We've also got what we call a virtual clinic service where you can make an appointment to have a video call with a GP, a physiotherapist, or a mental health counsellor. And with the video calls with the GP, they can prescribe, they can diagnose, they can issue referral letters, anything that a face-to-face GP could do. So those digital health services we're seeing as being are being very, very widely used. And then the second part of our plan then is, a bit more like traditional insurance where we pay for the cost of your everyday health costs. So if you go to a dentist, if you go to an optician, if you need to get a scan done, we'll pay for the cost of it. So to the extent that, health insurance or hospital insurance typically cover the cost of hospitals, our proposition is all about the everyday and the day-to-day, going back to kind of the insights we found from our research.
So that's the product offering. So who's the target market then for that?
Yeah, so look, I mean, we specifically and deliberately have built and developed our proposition for the younger adults. So we would say that 25 to 35-year-olds without health insurance are the group who we are specifically targeting. Of course, anybody can buy our product, and of course, anybody can benefit from our product. But we are specifically targeting that younger age demographic because they are less likely to have health insurance, as the data has shown us.
So provide us with an insight into the business model.
We work with Irish Life Health as our underwriter. And Irish Life Health collect the premiums and pay the claims and pay us to sell the product, pay us a commission to sell the product. So the business model is very simply, the claims are paid out based on the income we get. We charge €40 per month per adult. So everybody pays the exact same price, no matter, what, profile they have. Everybody pays the same price. And out of that, €40 per adult per month, we pay the claims, and then we run the business and the cost of services.
And of course, your current clients and the clients of the future in that particular target market, whilst they may need this product today, in a few years' time they're going to need health insurance. So are you considering that in terms of how you can build that into an income play going forward?
Yeah, it's a good question. And look, what I would say to that is, we are targeting people who have no health insurance today. They have no interest in health insurance today. So, we are absolutely confident that our proposition and the product that we've built is going to be more appealing than health insurance. But of course, people's needs change over time. So, as they grow older, as their own life stage changes, they might want to consider health insurance into the future. And, if that, as and when that happens, we'll certainly help them and advise them with that. But we expect actually that our product, in the way we have built it at the moment, is going to be something that they prefer and is more relevant to them, certainly in the more medium term anyway.
What about the corporate market and introducing this for their staff as an employee benefit?
Yeah, and it's really interesting. It's a great question, Carl, because when we launched VIGO Health in the middle of 2021, it was, primarily a consumer proposition. Our marketing and our marketing effort went into consumer marketing and trying to build awareness. But we were, organically with very little effort, we have been contacted by employers and by companies interested in our proposition. And I think what's happened particularly over the last 2 years and during the pandemic, around, bringing a greater level of awareness of employee benefits, and particularly health-related or health-focused employee benefits, that employers are much more aware and conscious of the need to provide a health cover or health benefit to their employees. And I suppose, what VIGO Health offers is, in some ways a lower cost alternative to full health insurance, which is outside of the financial reach for a lot of employers. But increasingly importantly, what we're hearing from our corporate clients is the need to provide really strong mental health benefits. And our product has very, very significant mental health support and mental health benefits. And that is an increasing, I suppose, need for employers. And I suppose the second, thing that we're hearing from corporates is an employee benefit that really fits and works with remote workers, where a lot of staff are working remotely now. And because of the nature of our services and the nature of digital health services, it really, really fits into that working or to the remote working model.
And Ruth, finally, what are your long-term growth plans for the business, and is there potential to bring this concept to the international market?
Yeah, I've been asked that before, and I suppose in the first instance, I would say, our growth ambitions for the product and for our business is, we're a brand that's 7 months old, so we need to, firmly establish ourselves and grow both our consumer and our corporate business here in Ireland. We've got some exciting plans around product development for this year as well, so we'll be extending our product proposition and, looking to, I suppose, constantly and continually innovate in the area of digital health and digital health services. With regards to international expansion, there are some fairly significant barriers to entry, particularly when you're looking at a kind of a regulated product, which is what we provide. However, I wouldn't rule anything out at this stage, but I would say, the focus for 2022 is kind of, I suppose, building our business and growing our business in Ireland.
Well, if you've just tuned in, that was Ruth Bailey from VIGO Health, and I wish Ruth and Stephen every success in growing their new business.
Southeast Radio's Business Matters with Carl Fitzpatrick.
Southeast